So you're exploring treatments for things like depression or anxiety. Maybe you've heard terms thrown around like TMS or maybe ECT.
Yeah, those terms can pop up.
And sometimes they can sound, well, a bit confusing, maybe even a little intimidating, right?
Definitely. There's often a lot of misconceptions surrounding them.
Exactly. So today we really want to clarify the real differences between these two brain-based treatments, transcranial magnetic stimulation and electroconvulsive therapy.
It's important to understand they're not really the same category of thing.
Right. It's not really apples to apples here. We want to cut through some of that confusion and, really get a deeper sense of why they stand apart.
Absolutely. Different tools for different situations, really.
Okay. And just before we dive in, we want to mention this discussion is brought to you by Sabres Medical.
That's right.
And for anyone wanting more info on transcranial magnetic stimulation, you can visit blossomtms.com.
blossomtms.com. Good resource.
Okay, so let's unpack this then. Where do we start with the big distinctions between TMS and ECT? Maybe the procedure itself.
Yeah, that's probably the best place to start because honestly, the patient experience is dramatically different right from the get-go.
How so? Let's start with ECT. What's involved there?
Okay, so with electroconvulsive therapy, ECT, the key thing to know is that it requires general anesthesia, always.
General anesthesia, okay.
Right, because the treatment itself works by intentionally inducing a brief controlled seizure.
A seizure, right.
So for the patient, this means it's a significant medical procedure. You absolutely have to fast beforehand like you would for surgery.
Makes sense.
And afterwards, there's monitoring. You're in a recovery area while you come around from the anesthesia. And, the immediate effects wear off.
And driving.
Oh, definitely not. You absolutely need someone to take you home afterwards. It really takes up your whole day. Often involves a hospital setting.
Okay, that paints a very clear picture. Quite involved. Now, how does TMS stack up against that procedurally?
It's pretty much the polar opposite in terms of the experience.
Really?
Yeah. TMS, transcranial magnetic stimulation, is completely non-invasive.
Meaning?
No needles, no sedation, and absolutely no anesthesia required. You are wide awake, fully alert the entire time.
Wide awake. Okay. How long does the session take?
Typically, around 20 minutes is common for many protocols, sometimes a bit less, sometimes more, depends on the specific treatment plan.
And what does it feel like if you're awake?
Most people describe it as like a tapping sensation or maybe a clicking right on the scalp where the magnetic coil is placed. It's usually quite localized.
Tapping. Okay, so no hospital gown, no recovery room fog.
None of that. You walk in, sit in a comfortable chair, have the treatment, and then you get up and leave.
So if I'm having TMS, what happens right after my session? Can I just, go back to work?
Absolutely. That's one of the biggest practical differences.
Wow.
Seriously, you finish your 20-minute session, you can walk straight out, get in your car, drive yourself wherever you need to go.
To work, school, errands.
Yep. Work, school, gym, grocery store, whatever's next on your list. There's no grogginess, no downtime needed, no chaperone required.
So you can literally just walk in, get treatment, walk out.
That's the idea. It's designed to fit into your life with minimal disruption. People often schedule it during a lunch break or before heading into the office.
That's a huge contrast to the ECT experience you described.
It really is. And these procedural differences, they really stem from the core mechanism, how each treatment actually works on the brain.
Right. You mentioned ECT induces a seizure. Let's talk about that mechanism.
Exactly. So ECT uses electrical currents passed through the brain to induce that controlled seizure. And look, it can be incredibly effective, sometimes life-saving, for very severe treatment-resistant depression or other acute conditions. It's been used for decades.
But the seizure itself, that has effects.
Well, yes, that generalized electrical activity that sort of reset across the brain while therapeutic is also why you can get side effects like temporary confusion, maybe some memory issues, disorientation right afterwards. It's a systemic shock in a controlled way.
Systemic shock. Okay. So then TMS, how does it stimulate the brain without causing that seizure? What's its mechanism?
It's a totally different approach, much more targeted. TMS uses magnetic pulses. Think of like MRI technology, but focused.
Oh, yeah.
These magnetic pulses pass easily through the skull, and they create very small, precise electrical currents in a specific area of the brain, usually the prefrontal cortex.
Prefrontal cortex. Often linked to depression, right?
Exactly. An area often found to be underactive, so TMS gently stimulates the nerve cells, the neurons, in that specific region.
Gently stimulates.
It encourages those underactive neurons to become more active, to fire more normally. Over time, this can help strengthen connections, improve communication between brain regions, basically promote neuroplasticity.
Neuroplasticity, brain changing and adapting.
Right. But crucially, it does this without inducing a seizure. It's focused neuromodulation, not a whole brain electrical event.
So the different mechanism leads to different side effects, presumably.
Precisely. That's where you see another major split.
Can you break that down, like side by side?
Sure. Let's take memory loss. With ECT, it's considered common, although usually temporary. With TMS, it's rare, very rare.
Okay, big difference there.
Then anesthesia risks. ECT obviously has them because anesthesia is required. TMS, none, because there's no anesthesia.
Right.
Confusion or disorientation right after treatment, often seen with ECT. Again, very rare with TMS.
Any overlap in side effects?
Both can occasionally cause a mild headache or maybe some scalp discomfort right where the coil was placed. That can happen with either.
But overall, much less systemic impact with TMS.
Absolutely. It's targeted treatment without that systemic shock, without the seizure and its associated immediate side effects. That's a fundamental difference.
Okay, that's really clear on the procedure and the immediate effects. What about accessibility?
Yeah.
And sort of the patient experience overall. ECT has often been seen as kind of a last resort, hasn't it?
That's a common perception, yeah. And historically, maybe more accurate, ECT is definitely an intensive treatment. It's incredibly powerful for severe, often acute situations. Think really deep melancholic depressions, psychosis with depression, severe suicidality, catatonia.
So specific, very serious cases.
Yes. In those cases, ECT can work faster and sometimes more effectively than anything else. It can be genuinely life-saving. So it's not just a last resort, it's sometimes the best resort for those critical conditions.
Right, it has its vital place.
Absolutely. But it does involve that intensity, the hospital visits, the potential cognitive effects we talked about, which means it might not be the first choice or even accessible or appealing for everyone outside those really acute scenarios.
So where does TMS fit in then? Is it aiming for those same acute cases or?
TMS is really emerging as a key player, often a first-line option after medications or therapy haven't provided enough relief for major depression.
So for treatment-resistant depression, but maybe not that acute, life-threatening stage where ECT might be needed immediately.
Exactly. It's FDA cleared for treatment-resistant depression. There's a lot of strong clinical evidence behind it now, and importantly, it's covered by most insurance plans. This makes it much more accessible.
Insurance coverage is a big factor.
Huge. It opens the door for many people who need an effective alternative but want to avoid the side effects or the intensity associated with ECT.
So thinking about that accessibility, what does a typical TMS treatment course look like? You mentioned it fits into daily life.
Yeah, typically it involves coming in for sessions 5 days a week, Monday through Friday usually.
5 days a week, that sounds like a lot.
It does on paper, but remember, each session is short, maybe 20, 30 minutes total time in the clinic.
Yeah.
And because there's no anesthesia, no recovery.
Right, you just go back to your day?
Exactly. So while it's frequent visits for a period, usually around 4 to 6 weeks, the actual disruption to your daily schedule is pretty minimal. People fit it around work, childcare, studies.
Much easier to manage for, say, working professionals, parents, students.
Definitely. That minimal disruption is a major advantage for many people who need treatment, but also need to maintain their daily responsibilities.
And we've actually heard from patients about this. It's not just theoretical.
Oh, yeah.
Yeah, one person told us something like, I was hesitant about brain stimulation, but the staff explained it wasn't what I thought. It was so easy, in and out each day. After a few weeks, I just felt like myself again.
That's great to hear. That feeling like myself again is what it's all about.
And another said, meds weren't working, and ECT just felt like too much for me. TMS was the best decision. I got better without turning my life upside down.
Those stories really capture it, don't they? Why TMS is becoming such an important option.
So, summing up why psychiatrists and patients might lean towards TMS.
Well, the key benefits are pretty clear now, I think. It's safe, generally very well tolerated, it's non-sedating, no impact on your alertness or ability to function.
Crucially, no seizure.
Absolutely crucial. No seizure activity, none of those associated risks, no hospital stay needed. It's an outpatient procedure. And as we've stressed, minimal disruption to your daily life.
It really sounds like a significant step forward in offering effective care that also respects the patient's life outside of treatment.
It really is. It offers a balance of efficacy and tolerability that's very appealing for many.
Okay, so wrapping this up, what's the big takeaway for someone listening trying to make sense of TMS versus ECT?
I think the main thing is, yes, both treatments aim to help with serious mental health conditions, but they get there in vastly different ways.
Different paths to relief.
Exactly.
Hmm.
ECT, powerful, sometimes faster acting, essential for certain acute, severe conditions, but involves anesthesia, seizures, potential cognitive side effects, and more disruption. TMS, targeted, non-invasive, no anesthesia, no seizures, minimal side effects, integrates much more easily into daily life. Very effective for treatment-resistant depression when meds haven't been enough.
So they really occupy different, though sometimes overlapping, spaces in treatment.
They do. And for individuals looking for something effective but less invasive, something that fits better with their lifestyle, TMS is a really promising path. Understanding these differences helps you ask the right questions.
Which brings up a good point for reflection for our listeners.
Yeah, what really matters most to you in a treatment? Is it the potential speed of response? Is it minimizing side effects? Is it how easily it fits into your daily routine? Or the overall intensity?
Those personal priorities are key when discussing options with your doctor.
Absolutely. It empowers you to have a more informed conversation.
Definitely. And if you are still exploring, or perhaps you're a clinician thinking about TMS for your practice, remember our sponsor, Sabres Medical, is a resource.
They work with providers on implementing TMS technology.
Right. So lots to think about. This has been really clarifying. Thank you.
My pleasure. It's important information to get out there.
And thank you all for joining us. If you want to learn more about transcranial magnetic stimulation, do check out blossomtms.com.
That's blossomtms.com.
Thanks again for tuning in.